Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
Things you need to know before going for C-section. Are you going to be a life giver? Are you also on this precious phase of your life? Do you also want to know about C-section? Then you are at the right place. Pregnancy comes with a lots of challenges. It is no easy job to deliver a child through your body. It takes both emotional as well as physical strength to perform delivery. Not every woman can have a vaginal delivery. There are situations where doctors have to opt for other options other than vaginal delivery. So, C-section is an alternative to that. C-section is better than a vaginal delivery. Consider all the health complications of the women. Doctors advise to family to go for this. Here are the things you should know before opting for a C-section. What is a C-section? A caesarean section is a delivery operation. In this process, the doctor makes an identical cut in your lower abdomen and womb and lifts your baby out through it. The classic caesarean section involves a long vertical incision. The vertical incision in the midline of the abdomen. The uterus is incised vertically and the baby is delivered. The whole operation takes about an hour, but time can be varying depending upon the situation. The news that your baby needs to be delivered via surgery or caesarean section might fill your heart with disappointment and anxiety. It is good to know everything about every possible situation before going for delivery. It takes a longer time for recovery. The increased risks include breathing problems in the baby and amniotic fluid embolism and postpartum bleeding in the mother. About 23 million operations were globally recorded in the year 2012. When to go for C-section? Doctors recommend C-section surgery typically only in medically necessary cases. Generally, when there are some high-risk pregnancies, when there is a history of miscarriage or undernourished child, when the baby is in a breech position, C-section is performed. Baby can't be flipped around before labor begins. In this case, the head of the baby is not downwards, rather in most cases upwards. Factors that might necessitate a C-section surgery. Number 1. Medical condition. If you have any chronic conditions like heart disease, diabetes, high blood pressure or kidney disease, it makes vaginal delivery stressful to your health, and a caesarean birth is a safer option in such medical conditions. Number 2. Mother's weight. If you are extremely overweight or obese, then it significantly increases your chances of caesarean section delivery. Also, because of the other risk factors like gestational diabetes, another reason is that obese women tend to have longer labors. Number 3. Age factor. Being old doesn't mean that it increases your chances of having a C-section, but with old age, there are several restrictions in your body. Doctors can't go beyond that, so to opt for a C-section that way is safer. Number 4. Large baby. Macrosomia is a condition in which the baby is much larger than average for their gestational age, which is the number of weeks in the uterus. It gets tough and hard to pull and equally hard for the mother to push. Number 5. Breech position. When the baby is either feet first or butt first in a breech position, doctors go for a C-section, and in this case it becomes necessary. Types of C-section. Number 1. The lower uterine segment caesarean section or LUCS. An incision is made above the pubic hairline and the bladder. It is a horizontal incision that cuts through the underlying uterus, and the delivery is performed by doctors. This is one of the most common methods of C-section delivery. As the bleeding risks get reduced after the surgery, other complications such as hernia are the least. The surgical wound recovers more easily than the traditional C-section wound. Furthermore, a woman may still choose a vaginal delivery for any future births. An emergency C-section is performed due to non-progress of labor and severe pre-eclampsia. It is usually done as a LUSCS procedure. Number 2. Caesarean hysterectomy. A caesarean hysterectomy involves removing the uterus during the C-section delivery. It is preferred as a reason of severe post-delivery bleeding from the placenta. This type of C-section is preferred when there cannot be made any separation between the placenta and the uterus walls. Are you also finding the right knowledge before heading up to C-section delivery? Then you are at the right place. Read for more information.
Thank you. Please like, share and subscribe to the channel. Click on the bell icon for important notifications and videos.